Hi, everybody. I want to welcome you to our discussion tonight. And this discussion is specifically for self-direct families. I was having some technical issues, so I'm about 4 minutes late. But I just want to do a tech check right now and be certain that you can hear me and see me. Okay, so I am attempting to broadcast on three different uh, sites, two on Facebook and one on YouTube. So if you are watching on Facebook and you want me to give you a shout out, here's what you do. This is just for Facebook. So on Facebook, if you want, again, us to know your name and your profile there on Facebook, you'll go to streamyard.com/Facebook. They have some way that they need to communicate together. Again, that's your option. You don't have to tell us who you are, but if you wanted me to give you a shout out, you can do that. So again, if you're watching on on Facebook, streamyard.com/Facebook. Okay. All right. All right. All good. Thank you, Mitzi. All right. Is there anybody on YouTube? Just let us know. And I want to thank the folks that are joining me tonight. Hi, Allison. And also the folks that might be watching this on replay later on. Hi, Lynn Platt. Good to see you. Hi, Tina. Hi, Jose. And rescue pup Adrian. Oh, that sounds so cute. All right, I love that. Okay, so folks, tonight's presentation, we wanted to bring people together to talk about a couple of things. It's going to be very focused. Oh, Jane is on. Hey, Jane. And so I just want to preface this by saying, I'm going to do a little bit of an intro and talk as people are entering the room. But tonight's presentation is really for self-direct families only. So if you're not a self-direct family, you're welcome to watch. But if you ask a question about a specific policy, etc., this is not really the forum to do that. This is a very specific forum. Hi, Denna. Oh, thanks for watching on YouTube. All right, so everything seems to be working. I was in a bit of a panic for a couple moments there, but I think it's working now. So we wanted to bring folks together for a very specific reason. So I do have a PowerPoint, but folks are still entering. So let me just wait just a little bit longer before I begin. And as you know, my name is Rita Young, or you may not know. And I'm here today for Unlock 2.0. And I'm going to tell you just a little bit about Unlock. And then we'll talk about this very specific reason why we are here tonight. So let us know where you're watching from, and also if you've been and how long you've been self-directing services, if you can remember. I certainly cannot remember because it was from the very beginning. I want to say at least 12 years, maybe 15. Does anybody remember? Yep. Okay. Anybody remember? Let me know. But how long have you been self-directing your services? Let us know that too. So where you, okay. Someone on Facebook says since 2008, which I feel very certain that's probably when it started in Georgia. Yeah, 7 years. Okay. Excellent. All right, let's see how many folks we have. Okay, we've got about 50 folks. This is great. Okay, 15 years. That sounds about right. Yeah, that does. So as you're entering, again, welcome. My name is Rita Young, and I am here tonight for Unlock 2.0. And I want to give a shout out to the folks that are watching specifically on the Unlock 2.0 Facebook page. We have a couple of other channels that I've added as well, but specifically for the folks that are watching on Unlock 2.0, that is where the advocacy activity is going on. So Kay says, since the beginning with Doris Johnson. Yeah, I'm in that same bucket too, Kay. Allison says 4 years. Okay, we've got 11, 4, 15, 7. Okay, this is great. So again, as you're coming in, tell us where you're watching from, how many years you have been self-directing services. I'm going to go ahead and start. I want to respect your time here tonight. So let's go ahead and get started. As I mentioned, I'm going to talk a little bit about Unlock 2.0. You may or may not be familiar with Unlock 2.0. There is a new advocacy coalition in Georgia. I hope you're excited because I am. We started in August. It is sponsored by GCDD, the Georgia Council on Developmental Disabilities, and it's administered by In Community. So just wanted to let you all know some very basics. Give a shout out if you remember the old Unlock the Waiting List. This is not Unlock the Waiting List. This is Unlock 2.0. We are rebuilding a statewide coalition specifically to advocate for home and community-based services for individuals with developmental disabilities in Georgia. We're going to be advocating as a coalition state here in the state of Georgia, and also we will be tackling federal issues as well. As we begin building the coalition, I wanted to let you know that we have a steering committee, and the steering committee represents statewide organizations such as the Georgia Advocacy Office, GCDD, of course, Statewide Independent Living Council, IHDD, or the Institute on Human Development at the University of Georgia, the CLD, the Center for Leadership and Disability at Georgia State, People First, Georgia Options, Parent to Parent of Georgia, and the ARC of Georgia. You know, I left someone off this list, unless it's at the very bottom and I can't see it. But the Service Providers Association on Developmental Disabilities, SPAD, is also a part of the steering committee. So as you can see, we have a wide representation of not only family members, self-advocates, organizations, and providers. The vision of Unlock 2.0, we envision an equitable society where the humanity of people with intellectual and developmental disabilities is recognized and respected. Mental, emotional, spiritual, physical, and social needs are met, and all contributions of people with IDD are valued. Give me a thumbs up if you really like that vision statement. What do you think? It's brand new. Our mission is through advocacy, we engage and educate stakeholders to expand and enhance home and community-based services to fully support. Thank you for the thumbs up, Facebook. To fully support Georgians with intellectual and developmental disabilities. Okay, so those statements, the mission and the vision, are straight off the press there. Those two are brand new. Thanks for the feedback. Great. So tonight is being sponsored by Unlock 2.0. As I mentioned, Unlock 2.0 is a project of GCDD, administered it in community. Our purpose here tonight is to discuss the rate study recommendations as it relates to the self-direct model for the now comp waivers. Okay, so whether you're watching live or you're watching on the replay, that is our purpose tonight. It's most relevant for families or individuals that currently self-direct. So if you're planning on self-directing and you're curious and you're here tonight, welcome. But we are focusing specifically on this rate study, how it might relate to our families. And so that's the discussion kind of in a nutshell this evening. And then of course, we're also going to talk about how to take action. Thank you, Catherine, for that feedback. Okay. All right. Has anyone heard of the IDD rate study that the Department of Behavioral Health and Developmental Disabilities executed? Has anyone heard of that? DBHDD, about 6 months ago, engaged an organization, a company called Burns and Associates, Health Management Associates is part of their name too. And they engaged them to do a rate study and analysis of all IDD services. Okay, I believe the last one was done, I think here are my notes, in 2015. So it was quite a while. So again, It was a deep dive into all of the IDD services and their rates and an analysis. The recommendations came out a couple of weeks ago. I think it was in the middle of December or so, or early December. I think more towards the middle. The recommendations that are being presented, I just want to make it clear that they're preliminary and are expected to change before they're finalized. So what we're going to talk about tonight hasn't already happened. So that is very favorable news for us. So just know we have the ability to make an impact here. DBHDD wants to hear from community stakeholders. That's another opportunity for us. Okay, which is great. If you would like to read the full report and listen to the full presentation, this is the website that you can go to do that. I will let you know that the presentation where they talk about the methodology for putting together this rate study is about 30 minutes. The full report where they explain the results is about an hour and a half. So just letting you know, there's also a PowerPoint that you can just read. So, that would probably be the best in terms of your time efficiency. But if you have the time to listen to it all, I would also recommend that too. Has anyone besides me and maybe several other people listened to it? Okay. So if the presentation tonight or this event feels very last minute, it's because it was. And so we decided just Tuesday to pull families together to talk about how the rate study might affect self-direct families and what we might do about it. So I've pulled several slides directly from the health management Burns and Associates. I don't see the full name of the organization. Directly from their slide. So this is not my slide. This is a screenshot of their slide, which is part of the analysis that they've provided. So they did the study, and so the results and the recommendations. This is part of those results and recommendations. You can find those if you choose to look at the PowerPoint presentation only. This one is, I believe, slide 38. If you watch the presentation, the slide numbers are slightly different. So just know that. All right. So one of the things I wanted to bring to your attention that we recently discovered is this third bullet point, which is a proposal to eliminate the personal assistance retainers. Now, again, I want to reiterate, these are only recommendations. Nothing is set in stone. There's a process here, and we have an opportunity to provide some feedback to DBHDD, and it sounds like they are welcoming of that feedback. So does anyone use a PAR, which is the Personal Assistance Retainer? Their thinking here is that it is billed by a few agencies only for only 5% of participants, representing less than 1% of CLS spending. Used by almost 15% of individuals who are self-directing, but still represents less than 1% of self-directed CLS spending. And another thing to think about too is when and if these changes go through, it would not be for another 2 years. So there is a process. And this next bullet really validates that. Retainers will be maintained through the ARPA spending period, and that is the American Rescue Plan Act spending period. Those are the federal dollars that states received across the country and have a certain amount of time to spend those. So I see that one person says you've used PAR for 15 years. I have also used PAR. By the way, I did not mention that I self-direct for 2 sons, and I did mention earlier that I've been doing it since the very beginning, so you all figured that out. Okay, I've never understood what a PAR. Okay. Glad you asked that. So again, on the table here is a proposal to eliminate the personal assistance retainer. Their reasoning here is low utilization. Okay, I'm not saying anyone agrees with that. So a very kind person who is on our chat this evening, and who is, I would say, if a parent is a subject matter expert on the comp waiver manuals and all the policies, this person is. So I asked if someone could send me the PAR specifically, and I had a feeling she would know exactly where it was, and she did. So if you need a refresher on PAR, the personal assistance retainer is a component of CLS designed to allow continued payment for community living support services while an individual is hospitalized or otherwise away from home, which I think a lot of us perhaps use if we're on vacation. You all let me know. Staff may not provide services in a hospital or nursing home setting, or if your individual is hospitalized, if there's other reasons for needing, if your individual is away from home for whatever reason too. There are 30 days per calendar year. So it's not an unlimited amount of PAR that we have. The retainer allows a continued payment to direct support caregivers for up to 30 days. So, and I'm guessing, I know this is how I use it. It's not, you're not using it all at once. You're using it, maybe 1 day here, 2 days here, 3 days there, that type of thing. Okay. All right. Catherine, that's really interesting. Okay. I'm going to come back to that. All right. So someone on Facebook says DBHD needs to hear from families about the importance of the PAR. The issue, many families don't understand what the PAR is and how to use it. I would agree with that too. That might be the reason for low utilization, is that families are not aware that they can use it. Would you all agree with that? So, Catherine, this is for your staff. So the PAR is used to pay staff, to retain staff, and hospitalization is one way that it can be used. It doesn't pay for any medical, it pays your staff for the hours that they would have worked that day. Okay. Someone says, okay, there may be other issues that you're having with that. Okay. All right, I'm going to move on. Are there people, it looks like there are people that didn't even know that this existed. If you are someone where this is the first time you've heard of PAR, please let us know. Okay. Yeah, someone on Facebook says, yeah, is this a distinct possibility that so many either don't know about it or know how to utilize it? I would agree with that. Louise and Bruce say that that has got to be part of the under usage. Yeah. You've never heard of it until the pandemic. Okay, that's really interesting. Okay. All right, folks are agreeing about the PAR. So there aren't many issues that we're going to talk about tonight, by the way. So there's not 6 or 7 issues. There's just a couple for us to be concerned about. Okay, we talked about the personal assistance retainer. The second one is a little bit more vague. I'm reading it, but I'm not 100% sure of its intent. But I still think that there's, in my opinion, DBHDD needs to hear from us regarding this particular one, because I reread it this afternoon and it meant something a little bit different to me. Okay, so let's look at this second bullet that says, again, this is directly a screenshot from the PowerPoint that Burns and Associates delivered to DBHDD. Wage caps would be set equal to the total assumption for wages, benefits, and productivity in the corresponding agency rate model. Okay, so what this means to me, and folks, you help me out, is they would like that for the self-direct to be more in alignment with what providers charge. Okay, if anybody says this is something a little bit different to them, they're giving us examples here. For example, it says, now, if you listen to the presentation, the presenter talks specifically about wanting to bring these self-direct rates in more in line with the traditional provider rates. Okay, so let's look at CLS. There says, for example, here. So that's why I'm saying it's vague, because there's no definitive. It's going to 26, 32. It says, for example. For example, CLS, basic 2632. For example, CAI 2707 and respite 2224. Okay. So in the presentation, and somebody just reiterated that, is reiterating it today. I'm going to assume this might be, I don't want to say who it is unless they give me permission, but I think I know who this is. Okay. There was a Developmental Disability Advisory Council, and the presenters, Burns and Associates, kept stating that some families are paying $100 an hour. So folks, if you are paying $100 an hour, that is so disappointing. That is not the intent of if you're paying a staff person $100 an hour. So I don't know, if this is one person out of 3,000 or something. I don't know, but I wish that we could get away from using these kinds of examples, because most of us, the majority, are doing the right thing. Hi, Heidi. I thought it was you, but I didn't want to call you out. So Heidi was, this is what she heard. If you listen to the presentation and on that website, and I'll show you again where it is. Where did it go? Okay. The presenter does talk about, $100 an hour. So it's not it is a horrible example. I would say that. Yeah. I don't know. I'm sure no one that is listening or watching tonight is doing that. That's a concern here. The word wage caps, in my mind, and also so let me know, and then would be set equal to agency rate model, which is again up in the air. And that's not something that I'm going to address tonight, because I'm not the best person to explain that agency rate model. But folks, what do you think about this? Because this is really concerning, a wage cap. So Catherine, thanks so much for bringing that up. Tonight, specifically, we're talking about the now comp waivers, not ICWP, but you might be using that as an example, Catherine. So I get it. Oh, I see. Okay. Wow. There's a difference between independent care and the now on comp. I will tell you. Yeah. So so let me know the reason that you decided to go self-direct, because part of the premise of the self-direct model, is the flexibility that we have. The flexibility to set the rate, the flexibility to recruit our own staff, to choose different services that we want to invest in, etc. And the CAI here, someone else, actually Heidi Moore brought this up on community access. The way that self-direct families use community access is different than the traditional provider model, right? We might use that community access on a one-to-one basis. Someone's going out in the community. We might also use it for a yoga class, an art class, something like that in the community. Yeah. Okay, so Jane is saying Jane, yes, it's already hard enough now to find staff, but this is a really valid point that Jane is making here. It makes it harder to compete with agencies who offer benefits and vacation pay, plus higher base hourly wages. Yeah, and so Jane is saying you went self-direct for that very reason. Yeah. So we're not paying benefits. We're not paying paid time off, which is interesting in the elimination of the PAR, because to me, they sort of go together. Traditional providers can pay paid time off, sick day. We can't pay sick days. No. Okay, others here. The, I don't know, Rhonda. That's an interesting question. That's a valid point. Is this for employee and vendor services? Because certainly the vendors cannot. Yeah, I would agree with that. Yep, thanks for bringing that up. There is also a participant direct advisory group. Um, and someone is saying here with the DBHDD members today, there happens to be that there were 2 meetings today, and then we plan this meeting tonight. So it's all, the timing is really, in a sense, perfect. Okay, so today there was a advisory group meeting. There's no way we can pay that amount because Nikki Klein will alert DD. Oh, that's about the $100. Yeah, yeah. That another good point. If you're paying some outrageous amount, it's going to get flagged, right? It's I'm hoping it's going to get flagged. Okay. Wage cap goes against the philosophy of participant direct. Yep. Oh, okay. Didn't know that. Yeah. So Jeff Thompson, Dr. Jeff says he only gets 1 or 2 alerts per week. Okay. That's good to hear. So again, the majority of us are executing self-direct as it's meant to be, right? Okay. So that's concerning, those 2 things. We have an opportunity to provide feedback, as I mentioned earlier. And again, the reason why we put this together so quickly is because we wanted to give families an opportunity to do that and enough time to do that. So the deadline, thankfully, was extended. Not that we had anything to do with it, but the deadline was extended to January the 20th. So we do have a little bit of time. So if you're watching on replay, it's January 20th is the deadline. We're suggesting, and I met with a group of families, we've been talking the last couple of days, that we send the email in DBHCD's recommendations. It says, or in the Burns and Associates, it says to send your comments to D. Barber. So this is Derek Barber at healthmanagement.com. We are also recommending that you copy or send at the same time to Ashley Caseman, who is the Director of Policy at DBHDD, and Jeffrey Thompson, Dr. Jeff, who is Director of Community Support Services. I hope I get that title right. Okay. So just the basics in terms of, you're obviously going to state your name, where you live might be something you might want to include, and why you are writing. So again, we are asking families to make public comment before January the 20th. Okay. And that writing and talk about that you are concerned about the proposed recommendations from the IDD rate study as it relates to self-direct families and individuals. Is Dr. Jeff's name? I think it is. I think it is. I copied it straight from my email. So if it's not, somebody please check that, but I believe it is correct. So Ashley Caseman, Jeffrey Thompson, and Derek Barber of healthmanagement.com. So again, include all these 3 individuals with, again, the direct instruction says to send it to healthmanagement.com, healthmanagement, this email, but we're recommending that you also send it to these at the same time. Okay. It's also important to personalize your message. Now, I know, I mean, right now it's 8 o'clock on a Thursday evening. We don't have hours and hours to write emails and re-edit, etc. But it's important to personalize your message. So whatever you can do to state your case and how these changes might affect your ability to self-direct, or how is it going to affect perhaps your son or daughter or family member. We have some suggested talking points for you. So I mentioned that there are a couple of items that we are concerned about, and that is the PAR being eliminated. And Heidi Moore and I remember when the PAR was, they talked about this about 10 years ago. And we were, able to provide feedback at that time to keep it in. And then secondly is to, now I've stated these in the positive, use your own language, these are just some suggested talking points to keep the flexibility of families to set their own rates. And why specifically? Why did you decide to choose self-direct? So again, this is an opportunity for you to personalize it a little bit. And then we're also asking DBHDD to include input from families that self-direct services in future rate studies. Can we all agree on that? I think that's critical. And so in the first presentations from Burns and Associates, it stated that in their methodology of creating this analysis and report, that they were going to speak to individuals and families. If you spoke to Burns and Associates, could you let us know? Because we have not been able to find any families that actually spoke to them. I think there are. But, we haven't been able to find that. So just know we're doing a little research behind the scenes on that. And then here's another one that we also wanted to include. A lot of times, DBHDD and the Department of Community Health as well, but this is DBHDD focused, will offer a virtual meeting, which is great. There's actually one tomorrow. But we would like to see a virtual component for families to be able to give testimony in the future. A lot of us are not able to come to downtown Atlanta, right? Especially if you live outside of the metro. So we'd like to see an option where there's virtual testimony options for future meetings where testimony is taken, right? So we can participate. Okay. What do you all think about this? Let's see here. Rita, can you? Yeah, is there anyone that was a part of the Burns and Associates work for Participant Direct that's on tonight? Yeah, so if there's someone that's on, please let us know. We'd love to know about the process, what that process was like. So by the way, there's a couple of ways you can grab these talking points. If you, let's see, if you want to take a picture of that, if you say, I feel like doing something this evening, you can do that. The recordings will be archived in all 3 places that I'm broadcasting. You can go back and look at this. And then I'm going to give you another way in just a moment to get the talking points, but that is one really quick way to get that. And I want to thank you for the talking point, for the feedback there. I want to thank the families that I talked to in the last couple of days. You know who you are, for helping put these talking points together. So just thank you so much. We did this very, very quickly. Okay, so another way that you can get the talking points, we invite you to sign up for Unlock 2.0 at unlockgeorgiainits.org. Okay, so if you give us your email, if you would like to, then you can get future alerts on the activities of the coalition. We will be having our first sort of official public meeting of the coalition in February. So we'll also offer a virtual option at that event. We'd love to invite you. You'll get a summary of the talking points. That means the talking points on that slide and where to send them to. If you can, once you send that email, and I have a feeling a lot of folks on here will, if you could just send me a quick note. You don't need to copy me on the email. Just send me a quick note saying I did it or done or something really fast, so that we can keep track of that. I asked the families that I spoke with just a couple of days ago, do you think we can get 50? So do you all think we can get at least 50? So Nita and the other Facebook user, if you'll go to unlockgeorgia.org, there is a place where you can sign up and put your email and be added to our mailing list. Okay, so Mitzi says yes, yes, yes. She thinks that we can get 50. Bruce says yes. If you can commit to writing an email before the 20th, if you could say yes, definitely something in the chat box. So again, unlockgeorgia.org, and we'll send you those comments. I mean, the talking points, the email addresses, or again, you can go through this particular presentation and find those, although we'd love to have you join Unlock 2.0. We will also be holding advocacy trainings in the spring, and they will be hybrid. So they'll be in-person and virtual. So we want you to be signed up for unlockgeorgia.org so we can send you that information when it's available. Okay, yes, we can get 50 and more. Okay. All right. Any, I don't know if I can answer questions if it's a policy related question, but anything else that, okay. Oh yes, there is something else I want to tell you all about. This is something you is optional, right? Tomorrow, DBHCD is having a virtual meeting specifically on this rate study. Did anyone hear about this? I saw it in a DBHDD provider email. So I registered and I'll be on, I mean, I'll be listening from 12 to 3 tomorrow. Has anyone heard of this meeting, and is anyone attending? It is virtual. Okay. Okay. Some folks haven't heard anything. So that goes back to our talking point of including input from families and including us. Yeah. Okay. So Mitzi's registered. Excellent. So know that some families will be on tomorrow, and we can update you on that. Okay. Also, the Georgia Council on Developmental Disabilities. Oh, look at that funny slide here. Okay, sorry about that. On January 10th is having another discussion on the rate study. That one will be more broad in scope. This one is specifically for self-direct families. The one for GCDD, Great Minds Think Alike, on this particular issue. Theirs will be broader in scope. They'll have different speakers talking about the rate study and how it will impact all types of services. So just know that is January the 10th. I will post that information. I just got it later today, so I'll post it on Unlock 2.0 and other sites as well. So just know I'm going to try to be up to January the 10th to listen in. I think I'm doing another presentation that night. But I highly recommend that you attend this, because I don't know about you, but sometimes I need to hear things multiple different ways from different people in different times, especially on this rate study. Not that we went into great in-depth analysis today, which I did not want to do. Okay. So that's another opportunity for you to learn what the facts are, to craft your message, although you can go ahead and craft it specifically on self-direct. I will let you know what time it is. If someone is on from GCDD, if you could let us know. I can't remember what time, but I'll post that information. In addition, we also are supporting GCDD as Unlock 2.0 for a Wages and Waivers Day at the Capitol. It will also be in person and virtual. So you've got your option. We like options, right? So it'll be February 15th. There's a 10 a.m. and 6 p.m. virtual option. Excellent. Then there's also, if you want to come in person, February the 16th at 9 a.m. This is all post-COVID, so I think it'll be a really interesting, exciting experience if you're able to attend in person. Registration is recommended, is required actually. And if you go on the gcdd.org website, you'll see their advocacy days and where you can register. Okay, So someone is asking the slide where I send the emails. Okay. Here is the slide with the emails. Okay, the GCDD Forum is 6 to 7 on the 10th. I think I can make that. I think my presentation isn't till later, so I'm hoping to make that. I also want to, yes, so this Facebook user at 813, we've focused on some of the hot concerns. The reason that I encourage folks to read the presentation, go to the GCDD analysis and event on the 10th, there are some positives too. So it's, you know, it's not doom and gloom, but we do have concerns. The assistive technology, there's an increase. There's environmental modifications went from 10 to 15,000. There's also another vehicle modification that went up. I have the notes here, but I'm going to not get it to it fast enough. And it's also allowed every 5 years. So it's not a lifetime cap. Yeah. So environmental modifications went from 10, as stated, to 15 every 5 years. Also, vehicle modifications went from 6420 to 15,000, and it's every 5 years instead of lifetime limits. I didn't say they, I just said they went to. This is all in proposal, right? Okay. GCDD, yes. So this is a more formal presentation. Thank you so much for doing this, GCDD. There's registration. Someone's posted a link there. I appreciate that very much. Yeah. So there are a few nice things. Yeah, absolutely. Vehicle mod increase. It hasn't been, this is all in proposal, but they are proposing an increase in vehicle modifications from $6,420 to $15,000 every 5 years instead of a lifetime limit. Yeah. So again, there are some positives. I highlighted the things that are of concern. But again, I encourage you to go through the presentation. And let me see if I can pull up that slide real quick here. Here it is. If you're interested in the full presentation, that's where you're going to find it at the bottom bullet here. So the links, there's a couple ways to get the links. You can, the easiest way is to join unlock.org with your email address, preferably going to unlock.org and signing up rather than putting it in the chat, because I'm afraid it will get lost in the chat. Okay. That's one way. You could rewatch this presentation. You could take a screenshot here. And I might be able to pull some of the relevant links as well. Okay. Any other? So again, just to recap, we're doing really well on time tonight. I'm very pleased. The proposal, again, it's in a proposal stage, has to go through several steps. And that's why it's so important for families to send comments in by January the 10th. We want to keep the personal assistance retainer as families. I'm telling you, but I think that's what we want to do. It is what we want to do. And then we also don't want wage caps. That defeats the purpose of Participant Direct. So if you could send that information, I'm just going to leave it right there. And, you know, again, as we listen to the presentation tomorrow from DBHCD and Burns and Associates, those of us that are family members, if you're a family member and attending, it would be great if we could ask, you know, were families invited to any of these listening sessions, etc. It is unlock. Yeah, not unblock. That's funny. Let me just take it to, there you go. Unlockgeorgia.org. The 20th is the deadline. So someone says that they can't register for tomorrow since I'm not a support coordinator, work for an agency or work for an advocacy agency. I think that's something else interesting that we could ask for in the future is to have another category for self-direct on some of the webinars, etc. Yeah, so the 20th is the deadline. That is correct. Any other questions on what to do, when to do it, who to send the email to? I registered. I'm not quite sure who this is. I'm a parent. I registered. I think I put self-employed or something. I think I might have done that in order to be able to register. Okay, so someone says that they selected support coordinator, then parent under agency. Okay, that's another interesting way to do it. Yeah, whatever works, Rhoda. Yeah. Okay, anything else, folks? Okay, so we're going to end a little on the early side. Again, GCDD, January the 10th. The 20th is the deadline. Join us at the Capitol virtually or in person on the 16th. Waivers and wages. The registration link, I believe you will just scroll up a little bit more. It's right here. So let's see if I can star it. I think I just starred it for you. Okay. Thank you all for participating. Thank you so much. It's so important that we stay engaged. I know we are pulled in 1,000 directions every day, but it's important to get the facts so that we can effectively advocate. So thank you all so much. Again, if you have any questions, you know where to reach me, and I look forward to hearing from you as a part of the new Unlock 2.0. Thank you so much, everyone. Take good care.